Hi everyone, so today we'll be starting with our second chapter, that is enamel. Enamel is divided into the following topics, and today we'll start with the physical and chemical properties. Okay, so physical properties, enamel forms the protective covering of variable thickness over the entire surface of the crown. So we know that if this is a tooth, the outermost covering of the tooth is called enamel. It is thicker on the lingual surface of maxillary molars and buccal surface of mandibular molars. So what happens is that this is your maxillary molar and this is your mandibular molar. Okay, so the enamel will be thicker over here and over here. And why so? Because these are the functional cusps. Okay, so when we chew, these are the main cusps that come in contact and they help in chewing. That's why enamel is thicker on these two cusps. It is brittle in nature and the modulus of elasticity, sorry, just a second. Yes, it is brittle and modulus of elasticity is greater at the surface than the dentinoenamel junction. So it is just a property that it is brittle in nature, so it can be broken into pieces easily. Not easily, but it breaks down into pieces. And modulus of elasticity is greater at the surface than dentinoenamel junction, so it is more rigid on the dentinoenamel junction. Dentinoenamel junction is where the enamel meets the dentine. Okay, so this is the crown and this is the enamel and this is the dentine. So this junction where they meet is called the dentinoenamel junction. The specific gravity of enamel is 2.8. Density decreases from cervical to incisal region and surface to deeper region. Okay, so the density is more on the cervical region and the uh, inner uh, inner regions of the tooth. Okay, it is an insulator at room temperature. It is semi-permeable in nature. Color of the enamel covered crown ranges from yellowish white to grayish white. The variation is due to difference in degree of calcification. What happens is that the enamel doesn't have a color of its own. Okay, so the enamel, so if this is your tooth, the enamel doesn't have a color of its own, and slightly it will show the color of what lies underneath it slightly. So the dentine is yellow. Okay, and enamel is thicker in this region, but going down it will become thin. So that's why when we have this, this is kind of what the enamel will look like. Okay, and going down it becomes thin, so your teeth appears yellow in the downwards region. And on the surface, on the not on the surface, on the incisal edge, there will be no dentine. Okay, so the enamel is generally seen as a blue line on the incisal edge, not blue, mainly grayish line, because there is no dentine. So the enamel will be yellowish in the cervical region, and there is a gray or bluish line on the incisal edge because it is translucent. Now coming to chemical properties of enamel. Chemical properties, so it has 96% inorganic material and 4% organic material. What is the inorganic constituent of enamel? So the enamel, the inorganic constituent is hydroxyapatite crystals. Okay? This forms the entire mass, the inorganic mass. This is the formula of hydroxyapatite crystal, and they form enamel rods. Okay, so enamel rods are something like this. These are hexagons, and they will grow like this, and these are enamel rods. Okay, and so this is the base of that hexagon, that enamel rod. Imagine this was the rod, and this is the base is in the form of a hexagon. So this is the base, and this is the structure of hydroxyapatite crystal, which will form the enamel rods. Now coming to the organic content of in the enamel, contains 90% amelogenins and 10% non-amelogenins. These are proteins. Okay, so in the organic content, it contains proteins, and the 90% are amelogenin proteins and 10% are non-amelogenin proteins. Amelogenins are heterogeneous in nature. They are of low molecular weight. They are hydrophobic, and they are rich in proline, histidine, glutamine, and leucine. Whereas non-amelogenins, they are of high molecular weight. They are rich in glycine, aspartic acid, and signin. And the examples are enamelin, tuflin, and ameloblastin. This can be asked in the viva. Sometimes important. Okay, now water. Water is present as a part of the crystal, the hydroxyapatite crystal, in between the crystals and between the rods and surrounding rods. So basically, if I have an enamel rod over here, and this is composed of this crystal, right? So there will be, I'll just draw it using a pen. So this is my enamel rod, and these are the hydroxyapatite crystal. So water will be present in between the crystal, obviously not in so much amount. It will be present in between the crystals, between the rods. So there's this rod and there is another rod. So it will be present in between the rods, and surrounding the rods. Okay, so basically outside the rod as well, water will be present. Pores are present between the crystals, especially in the boundaries of the rods, and these are filled with water. So there are some pores in here as well in the rods, and they will be filled with water too. Enamel proteins do not contribute to structure of enamel, in contrast to collagen, which is the principal protein of dentin or bone, having a structural function. Okay, so enamel proteins, when I have these rods right in the structure, so these rods form the main structure of the enamel. Enamel proteins will be mainly a part of the matrix. They lie here and there, so they don't have any function with the structure of or strength of the enamel. Whereas collagen, uh, it provides strength in most of the tissues we'll study further. So there is a contrast between the proteins present in enamel and the protein which is collagen, which will be present in the dentine or pulp or bone, sorry. Now coming to structures of enamel, I will cover all the structures of the enamel in next video, but for now I'll just teach you the rods and the ultrastructure of enamel. Okay, so what is enamel composed of? This is the crown. Okay, enamel is composed of these rods. Obviously this entire space will be filled with rods, and what happens is, so there are three components to enamel. First is this enamel rod. If I zoom into here, first is this enamel rod. Second is the rod sheath. So you see this greenish thing, it is covering the rod. So this is the rod sheath. And third is interprismatic enamel. So when enamel is formed, there are two components formed by the ameloblast. One is the enamel rod, and second is the interrod material, which is the interprismatic enamel. So it basically fills in the space between two rods or multiple rods. Okay, so this is what said. The enamel consists of enamel rods or prism rod, rod sheath, and interprismatic substance. Number of rods ranges from 5 million in the lower lateral incisor to 12 million in the upper first molar. So obviously the lower lateral incisor is the smallest tooth, so it will have the least number of enamel rods, and the maxillary upper first molar is the largest tooth, so it will have the most number of enamel rod, that is 12 million. Rods run at a tortuous course from the dentinoenamel junction to surface. So what it means is that enamel rods won't go like this. Okay, they won't go straight. They run in a wavy kind of fashion, and they start from the dentinoenamel junction and they end at the surface of the enamel. Obviously, they form the enamel. Rods located in the cuspal region are longer than the ones located in cervical areas. Okay, so this is very much common sense that if the cervical area is thinner, so the rods over here will be shorter and the rods in here are longer in the cuspal region, because that the cusps are higher up, so the rods in here will be longer. Rods look okay. The average diameter of the rod is 4 micrometer. However, it varies throughout. It is near the dentinoenamel junction. It is thinner than the surface. So I have drawn in this diagram. The average diameter is 4 micrometers. Okay, but when the rod starts in here, it is thinner, and then it keeps getting thicker over here. Because there is more surface area over here, so the rods will be thicker. And if I take the diameter, so I have zoomed in over here, right? So if the area of this portion is 2, the area of this portion will be 1. So at the dentinoenamel junction, it will be 1, and in the surface it will be 2. So this is the ratio of diameter. So not the area, it is the ratio of the diameter at the dentinoenamel junction to the surface of enamel rods is 1 to 2. Okay, so it is twice as much thicker on the surface than at the dentinoenamel junction. So these are the enamel rods. Now coming on to the ultrastructure of enamel. What is ultrastructure? It is what's seen under a microscope. So many minute structures and like details of the enamel rods I'll study in here. Enamel rods appear to be like fish scales or keyhole pattern under light microscope. So when a picture of enamel is taken, it appears kind of like this. I should have inserted a picture. So it will appear like this under the microscope, like fish scales or keyhole pattern. Why it's called a keyhole pattern, I'll explain right now. They measure 5 micrometer in breadth and 9 micrometer in length. Striation appears. Okay, so I'll explain this first. So I had this crown. Okay, I took a picture of this, and it appeared kind of like this. Okay, so this is the ultrastructure of enamel. This is how the rods look like under the microscope. Why is this called a keyhole pattern? You see this shape, right? This is one enamel rod, this thing, and it appears like a keyhole. Now there are also some striations visible. Okay, so if I take a picture over here, you will see there are two kinds of substance. Okay, one is this and one is this. So this is interrod material. Okay, the not this, like this line and this whole area. So this is interrod material, the line, and then this whole area is enamel rod. So these two different substances, they give rise to striations. So striations appear in the ultrastructure of enamel. Now what else is happening? Uh, so I just wrote that striations appear due to placement of rod and or interrod substance in alternate positions. Now there is one more type of striation, that is that is cross striations. Just a second. So there's this another type of striation, that is cross striation. And what are they? So if I take this enamel rod out in here and I view it from the side lengthwise, so this is the head. Okay, so there are some striations on the enamel rod itself, and these are called cross striations. And how are they formed? They are formed because of the formation of enamel. So if it is a rhythmic deposition, so the enamel was formed, and then there was a period of rest, and then it was formed, and then there was a period of rest. So that period of rest, in that period of rest, there is still enamel forming, but it has a slightly different consistency to the enamel that was formed in the active period. So that's why it appears darker, and they give rise to cross striations in the enamel rod, and these will be visible otherwise as well. Okay, enamel rod due to rhythmic enamel formation. So this is what's written over here. Striations appear due to placement of rods and interrods in alternate position. Cross striations within the enamel rod due to diurnal rhythm in enamel formation are also present. Now the enamel rod, what is this made up of? Okay, now this contains hydroxyapatite crystal. Okay, if I cut over here, so there will be like one crystal over here, one. So this is made up of hydroxyapatite crystal. It lies parallel to enamel rods. You had seen in the previous slide that that was hexagonal in shape. Okay, so hydroxyapatite crystal. This is a hydroxyapatite crystal. It lies parallel to the enamel rods. Deviation of up to 65 degrees can be observed. So generally it's parallel to the enamel rods, but it can be sometimes it might be tilted slightly up to 65 degrees. Okay. Organic matrix forms an envelope around the HA crystal. So whatever we had, there was only 10% organic material, sorry, 4% organic material, and that organic material forms a kind of a sheet over this hydroxyapatite crystal. This is where the organic material lies. It may also exist in between the crystals. So there is one crystal, and then there will be organic material, and on top of this there will be another crystal. So organic material lies around the crystal and on top of the crystal, or below the crystal. Okay, so this is okay. So what are the incremental lines of Retzius? They represent an incremental pattern of enamel deposition. What that means is, so let's just see first over here. They appear as brownish bands in the ground section, and they show incremental pattern of enamel deposition. What does an incremental pattern mean? That okay, so the enamel will be deposited. There will be one active period, and then there will be a period of rest, and then there will be another active period. Okay, so if I have let's just say that this dark blue line, it represents a very active period of enamel deposition, and then I have this light blue line. Okay, so this will show like a slightly inactive period, and then I have a very dark blue line. So this is called incremental period of, and this is called incremental pattern of enamel deposition. In the longitudinal section, this incremental lines of Retizus, they surround the dentine tip. Okay, so they appear this circular in the longitudinal section around the dentine tip. They run obliquely in the cervical parts. They run like this in the cervical part. Okay. In transverse section, they appear as concentric rings as well. So in the transverse section, you will see over here, if I cut a tooth from here, they appear as concentric rings. Alright. Along with incremental deposition, they also show variation in the structures and mineralization that occurs during enamel growth. What it means is that in the active, this dark blue active phase, right, the enamel will have a different consistency. So it might be more mineralized than this light blue in the resting phase. In the resting phase, enamel is still being formed, but maybe it's less mineralized, or it will have a different consistency. Okay. The daily mean rate of enamel formation is 3.5 microns. So this is the how much enamel is formed daily. It is greater in the outer and the incisor and cuspal region. So the in the outer region and the incisor region, maybe the enamel that is formed, it is formed faster. Okay. Evenly spaced try of Retzius represents 6 to 11 day rhythm. So this these gaps you see in here. So every gap, every band, this band, it represents a period of 6 to 11 days. Okay. Metabolic disturbances may cause prolonged rest periods, which bring the lines close together, and therefore it broadens the line, making it more prominent. So what will happen if I have a metabolic disturbances? Okay, a disturbance. So this resting period will be prolonged, and if it is prolonged, what will happen is that in let's just say that this thing took 6 days to form. Okay, so now in 6 days, only a small amount of this enamel will be formed, very small amount. So if a small amount of enamel is formed, these two lines, the dark blue line, it will come close together. Okay, so these lines will broaden and this resting phase will increase and there won't be so much enamel formed. So this will appear broadened and this will appear reduced. Okay, so it broadens the line, making it more prominent. All right. Now moving on to the surface structures of enamel. What are surface structures? These are the structures present, microscopic structures present on the outer enamel. So if I took a tooth and I looked at it using a microscope, I'll see these structures. So what is the first structure? First structure is prismless enamel. What is prismless enamel? So normally the enamel is arranged like the rods are arranged regularly, okay? But in the prismless enamel, this area, the rods are very haphazardly arranged. Okay, so this is called prismless enamel. It is approximately 30 micrometers thick and it is generally present in the cervical region. It is present in 70% of permanent teeth and all deciduous teeth. Okay, and the hydrox A apatite crystals are parallel to each other and perpendicular to the striae of Retizus. So this is the regular way of arrangement of hydroxyapatite crystals. That if this is the striae of Retizus, they will be perpendicular to the striae and parallel to each other. Okay, it is a heavily mineralized structure, heavily mineralized compared to the other enamel that is on the tooth. Okay. Other surface structures that are present on newly erupted tooth. So this is present in all tooth. Okay, in the permanent and the deciduous. But and perikymata, rod ends, and cracks. These are the other surface structures that are present on newly erupted teeth. Okay. Moving on. Uh, just a second. Moving on to the surface structures, perikymata. What are perikymata? They are external manifestations of striae of Retzius. What that means is that I was having the striae of Retzius, right? So it will bulge slightly. The line will show a slight bulging on the outer surface. Okay, this slight bulging, it appears as this. You might be able to see these transverse. Sorry, and these transverse groove like structures, okay, these wave like structures. So this is called perikymata. It is just how the striae of Retizus represent itself on the outer surface of enamel. There are 30 perikymata per millimeter in the region of cemento-enamel junction. So over here in the cervical region there will be 30 perikymata per millimeter, but it decreases to 10 per millimeter in the incisal and the occlusal region. So over here it will be decreased and it will be around 10 per millimeter. Cracks. What are cracks? Okay. So cracks are fissure-like structures. They are present on the outer edge of enamel. They are the outer edge of enamel lamella, and they are present at right angles to dentinoenamel junction. Okay. So these are basically cracks are gaps in the enamel, and they are present on the outer edge. Okay. They are present on the outer edge, and they are present at right angles to dentinoenamel junction. So if this is a dentinoenamel junction, they'll always be perpendicular to the DEJ. Rod ends. They are concave and vary in depth and shape. They are shallowest in the cervical region and deepest in the occlusal region. So if this is a tooth and my rod is ending over here, so it will end kind of like this in this shape. Okay, it will show a concavity. So this concavity appears kind of like a pit in the microstructure. So let's just say that this appears like a very shallow rod end, and this is a very deep rod end. So the deep ones will be present in the incisal region, and the shallow ones they will be present in the cervical region. Okay. Now, neonatal lines. So, what are neonatal lines? Neonatal lines, it is a line that demarcates the prenatal and the postnatal enamel. Okay, so there is some enamel that is formed before birth. This is called the prenatal enamel, and then there is some enamel which will be formed after birth. So, this is the postnatal enamel. Uh, this is prenatal, and there is a difference. This line which demarcates them, this line you can see over here, the dark brown line, it is called the neonatal line. So why is there a difference between the prenatal and the postnatal enamel? Is because when the baby is in the womb, the enamel formed is of higher quality, and it is of higher quality because all the nutrients are supplied, and it is the fetus is a very well protected environment. So this high quality enamel is formed, prenatal enamel. But after the baby is formed, there is a compromise on nutrition, and it is not that well protected, so a lower quality enamel is formed. Okay, and this line, the neonatal line, it demarcates the area between them. Okay, so it distinguishes the prenatal and the postnatal enamel. It appears as an accentuated line of Retizus, so it is brownish in color and it appears like a line of Retizus. The difference in the quality of prenatal and postnatal enamel is due to abrupt change in the environment and nutrition of newborn infant. So I already explained that to you. The prenatal enamel is usually better developed than the postnatal enamel because the fetus grows well in protected environment. I already told you that, with an adequate supply of all the essential materials. So there is no compromise of nutrition when the fetus is inside the womb. More frequently, this line is absent in the first molar of boys than girls, indicating that the girls are more dentally mature. So it is generally absent in the first molar of boys. Okay, this line is generally absent. Now, surface ultrastructures. What are other surface ultrastructures of the enamel? There are pit, enamel caps, and enamel brush. What are pits? These are tiny depressions of 1 to 1.5 micrometer in diameters. They represent the end of ameloblast. Okay, so if a tooth was being formed, okay, and then towards the end there was this ameloblast, and it was over here. So this convexity that stayed in the on the outer surface of the tooth, this formed pit. Okay, what are enamel caps? So enamel caps, remember, these are elevations. Okay, these are not depressions. You have to correct this in your notes as well. So it is elevation of about 10 to 15 micrometer in diameter. It is due to enamel deposition on non-mineralizable debris. So if I continued so there is a bulge over here and there is some organic material, and I continued in enamel deposition over this, so this will cause enamel cap. Okay, and enamel brush, they are a larger enamel elevation, so they are basically bigger enamel caps. Okay, so what are Hunter-Schreger bands? You can see in this diagram that they are light and dark bands. Okay, they appear in the longitudinal section of a tooth. What is a longitudinal section? I'll explain over here. Just a second. So if I have this tooth over here, right, this is side view of a tooth. Not a very good diagram. Just a second. Right, I have this tooth, and I take a knife or a cutter, whatever, and I cut it over here like this. So this will form a longitudinal section. Now I told you that we have many enamel rods in the tooth, right? So there are many enamel rods going in all the direction. So what would happen is, just imagine two enamel rods, because they're going randomly in all the directions. I have one enamel rod that was going like this. Okay, let's just imagine this, and I have another enamel rod. It was going like this, maybe. All right, so what would happen that if when I cut this tooth, right, so these two enamel rods, one, it was cut like this over here. This is cut longitudinally. Okay, and then there was this enamel rod, and this was cut transversely. You see the difference between transverse and longitudinal. So this was cut longitudinally, sorry, and this was cut transversely. So the rods which are cut longitudinally, they are called parazones. Notice over here, they are called parazones. And the rods which are cut transversely, they are called diazones. These diazones, they appear light. Okay, so this light bands you see are here, it's these enamel rods. They are cut transversely and they appear light. And these dark bands you see in here, these are these are the parazones. Okay, and they are cut longitudinally. So this is the entire concept of light and dark bands, Hunter and Schreger bands. Now going to the notes. These are alternating light and dark bands of varying width seen under in longitudinal ground section under obliquely reflected light. So this is only seen under obliquely reflected light. Remember that. They are present mainly due to the change in direction of the rods. So you saw that because two rods were going in different direction, this is why the rods appeared. Okay. The dark bands are called parazones and the light bands are called diazones, and I explained to you how they are cut longitudinally and transversely. Okay, they originate at dentinoenamel junction and end at some distance from the outer enamel surface. So you can see over here, just a second, I'll erase this. So they originate at dentinoenamel junction because that's where the rods originate, and they end at some distance from the enamel. Okay, the angle between parazones and diazones is about 40 degrees. So the angle between these two would be about 40 degrees. Other than being optical phenomena, the alternate zones may also appear due to slightly different permeability and different content of organic material. So this is an optical phenomena, okay, because this appears like this under the light. But other than that, the light and dark bands may also have something to do with slightly different organic content, okay. So this might be one band might be slightly more mineralized, and the other band may be slightly less mineralized. It is a functional adaptation against masticatory forces. How is that? Because it's due to different direction of the rods, okay. And the more the rods are in random directions or intertwined, the stronger they are as a bunch. So it acts as a adaptation against the forces acting in it. Okay. Coming to gnarled enamel, what is gnarled enamel? It's similar thing. Okay, it is just I'll explain to you first to the diagram. So it is just intertwined enamel. It is present in the cuspal areas, okay, in the high areas which face the masticatory forces the most. It is present in the incisal edge and the cusps, and you see all the rods over here is like more regular, but this is more irregular. Why is that? So let's just say I have this rod, okay, and they are all going in straight in one direction. Now I have this force acting. What will happen? They're not intertwined. What will happen is these rods will go like this. Okay, they will bend against the forces. But if same rods are intertwined like this, all right. Now, if um, a force acts, they won't be pulled apart. So this is how it's a adaptation against masticatory forces. All right, both this and the Hunter-Schreger bands, okay, because they're both due to a different direction of the rods running in the enamel. So it's an optical appearance of the enamel near the dentine in the region of the cusp or incisal edge. The bundle of rods appear more irregularly intertwined. It's a functional adaptation against masticatory forces. Okay. Now coming to enamel cuticle. What is an enamel cuticle? I'll explain to you first. What happens is that I had this. Imagine I have this tooth. Just a second. I have this tooth. It's still in the gum. It hasn't emerged yet, or it hasn't erupted yet. And now surrounding this is all the connective tissue. What will happen is just now my ameloblasts finished making enamel. So they're done with making all the enamel. Now they want to protect the enamel, because if the enamel comes in contact with this surrounding tissue, it will get resorbed. So what will ameloblasts do? While terminating the enamel formation, they will leave this last layer. Okay. We will study this in detail in the next video in amelogenesis. So they will leave this layer over here. When the tooth erupts, okay, now the tooth has come up. When the tooth erupts, now it won't be resorbed, of course. In the oral cavity, it's safe, but the membrane, the ameloblast left, it's still there. This membrane, this whole membrane, this thing is called enamel cuticle. Okay. So this is also called Naismith's membrane. It covers a newly erupted tooth, but is soon removed by mastication. Alright. Now, it is a type of basal lamina secreted by ameloblast when enamel formation is completed. It protects the enamel from resorption by surrounding connective tissue before eruption. So I explained to you both these points, and it is removed by mastication, so it won't stay there for long. What is enamel pellicle? Just ignore this. What is enamel pellicle? It is similar kind of thing. So I have not similar. So it's present on an erupted tooth. I have this tooth, okay, and surrounding this tooth is saliva. Surrounding this tooth is saliva. So what saliva will do? It will precipitate some proteins over here, and these proteins are generally removed by brushing. But what would happen if I don't brush my teeth for 2-3 days? These proteins won't be removed, and this will allow bacteria and microorganisms to colonize this. And when they colonize this, they will form plaque. Okay, they form plaque. What is plaque? If you look at your teeth, most probably you will find in the cervical region, like in the ends, hard to clean areas, you'll find this yellowish deposition. That is what plaque is. Okay, and this enamel pellicle, which is basically salivary precipitate, it can be removed mechanically, but it reforms within hours of removal. That's why you have to brush your teeth 2 times a day. After 1 to 2 days of formation, it becomes colonized by microorganisms and forms plaque. So if your teeth is not cleaned for 1 to 2 days, it will form this plaque. Okay, so this is what enamel pellicle is. Now coming to enamel lamellae. Enamel lamellae, it is thin leaf-like structures that extend from the enamel surface towards the dentinoenamel junction. They may also sometimes penetrate into the dentine. They consist of organic material with little mineral content and are of 3 types. So what is enamel pellicle? Sorry, not enamel pellicle, enamel lamellae. They basically look like cracks, okay, and they are in a way cracks. What are they? They are cracks in the enamel, they originate from the enamel surface and they are filled with some organic material. Okay, they originate from the enamel surface. They may also go deep down into the dentine. So the type 1 won't won't go down into the dentine, but type not type 1, type A won't go down into the dentine, but type B and C may enter the dentine. Okay, so what is filled into these cracks? Based on this, it is divided into 3 categories. And what are the categories? Type A, B and C. So type A contains poorly calcified enamel rods, B contains degenerated cells, and C contains some organic material. Okay, now A is generally restricted to enamel. So what I told you, that A won't go down into the dentine, but B and C may actually enter the dentine. It is a site of weakness in tooth, which may serve as a pathway for bacteria initiating caries. So of course this is filled with organic material and this is a crack, so it may serve as a pathway for bacteria to enter the tooth. Okay, so this is enamel lamellae, and they appear leaf-like. I think I mentioned this before. So they appear leaf-like and they appear very similar to cracks. Also there was this point mentioned in the Albans. Decalcification of ground section of enamel makes possible the distinction between cracks and enamel lamellae. The former disappears while the latter persists. So what I told you, that enamel lamellae and cracks look very similar. Okay, so how do we distinguish? So let's just say this is a crack and this is a lamellae. So my crack has nothing in there. Okay, it's empty space, but enamel lamellae will have some organic material in here. So how do I distinguish between this? What will I do? That I will decalcify the tissue. Okay, so when I decalcify the tissue, everything surrounding the crack will dissolve. And since this is already empty space, so nothing will remain. But when everything surrounding the lamellae dissolves, it has some organic material. Okay, so that will remain. So everything is dissolved. You can see the crack disappeared, but this organic content remains, and this is how we distinguish cracks and enamel lamellae, through the decalcification. So the cracks will disappear, but the lamellae will stay there. Alright. Now coming to enamel tufts. What are enamel tufts? Enamel tufts are nothing. They are like, you see this picture. They are grass-like structures. That's why they are called enamel tufts. And what are they? They are just hypomineralized enamel rods. Basically, enamel rods with low calcium content. They arise from the dentinoenamel junction. They may go up to like 1/3 of the entire enamel height. Okay, and there's one major organic content they have. This is called 13.17 kd protein. So this is one of the major organic component of the tuft. So they are narrow ribbon-like structures. This is how the shape is named. Not named, but what it looks like, ribbon-like. They arise at dentinoenamel junction and reach into the enamel 1/5 to 1/3 of its thickness. They consist of hypocalcified enamel rods. Okay, and so they're basically hypocalcified enamel rods and contain interprismatic substance. The major component is 13.17 kd protein. Okay. Now coming to dentinoenamel junction. What is dentinoenamel junction? We know it's the junction between the dentine and the enamel. Okay, but there's just one basic concept, that when you draw your histology diagrams, you would draw it like this. Okay, you can even see that it appears like this is called scalloped appearance. And why does it appear scalloped? So enamel rods has many. It's pitted. The junction is pitted like this. Okay, and why is it pitted? Because when the enamel is formed, so this section above the dentine, there would be ameloblasts. Okay, and these ameloblasts formed enamel. So these ameloblasts were sitting in these pits. Okay, so when it's formed and everything, these pits remain, and that's why in a ground section, the dentinoenamel junction, it appears scalloped, and this convexity is always towards the dentine because there was maybe an ameloblast sitting over here when the enamel was being formed. So this is the conceptual part that was involved. The surface of the dentine and the dentinoenamel junction is pitted. The section therefore appears scalloped. Convexities are directed towards the dentine because obviously there was an ameloblast sitting over here, so it will be always directed towards the dentine. The rounded projections of enamel fit into these pits. This ensures a firm hold of enamel into the dentine. So when the enamel is formed, it is actually like embedded into this structure. So this is very tightly bound together. Okay. So this is dentinoenamel junction. Now enamel spindle, the last topic. What are enamel spindles? I'll explain the concept first. So look at this diagram. This is odontoblast. Just use this. These are odontoblasts. What are odontoblasts? They are dentine forming cells. So when I had, this is what they look like. Okay, this is the cell, and they have this extension. an extension is also called a process. Okay, so this extension may enter the enamel at the dentinoenamel junction. The odontoblast present may have an extension into the enamel, and this extension is called enamel spindle. Okay, so odontoblastic process which cross the dentinoenamel junction and enter the enamel are called enamel spindles. They are present at right angles to the surface of dentine. So you see they are present at 90 degrees to the surface of dentine. In ground sections of dried teeth, the organic content disintegrates and is replaced by air. The empty space appears dark. In transmitted light, sorry, I forgot to add over here, in transmitted light. So what happens is, what this point is saying is that so I imagine I did I removed everything. Okay, in the ground section I removed everything, and this organic content will disintegrate. So all instead of this enamel spindle, only space will be left, and that space appears dark in transmitted light. Okay, so that's it for all the structures of the enamel, and I'll continue with amelogenesis in the next video. If you like the channel, please like and subscribe. And for the notes, you can go to the Telegram channel. The link is mentioned in the description. Thank you.